Well, hello, hello, hello. I am Pastor Rhonda, founder of Celebrate Life, and your host for Celebrate Life today. And we are here today with Attallah Dillard, and we're going to have a great conversation about sexual health and the African American woman and how to have conversations with your doctor. So please allow me to introduce to you Attallah Dillard.
Thank you so much, Pastor Rhonda. It's an honor to be here, and I really do appreciate this opportunity to discuss a topic that some might find controversial or definitely sensitive in nature, but really important for our community. So thank you so much.
Not a problem because, when I think about sexual health, I realize that a lot of people really haven't had that conversation since they were 12, if
Exactly.
they had it then. So as we grow and we mature, we age, we have health situations, we have trauma, we have all kinds of different things that occur in our life. There are things that we need to just take a deep breath, sit back, and have that conversation so that we can be a benefit to one another. Because there's so many things that occur in our lives that we think it's just normal, or we think it's going to pass, or we think we're the only one. So who's going to believe me if I tell you this? And so we really want to make sure that we're able to share the information with individuals as they prepare to go and speak with their doctor.
Exactly. And just like you mentioned, sexual health is not something that's discussed later on in life, or at least not frequently in our society, and especially among the African American community. And when we think about the term sexual health, it's not necessarily just the act of having sex, right? Or sexual behaviors. It's a lot more all encompassing. So I'm going to read the World Health Organization's definition just to give everyone some insight. So sexual health is defined as a state of physical, emotional, mental, and social well-being in relation to sexuality. So it's not just how you're feeling physically, but how you're feeling emotionally, mentally. And we know that there are a number of health issues that can influence that. And we need to be aware of those things and have the confidence in be informed enough to have these conversations or initiate these conversations with our providers.
Exactly. All right. So why don't we just go ahead and just
Let's
jump
look
right
into
in?
it. Yes. So, just a little background about me. I am a registered nurse by practice, and as well as a full-time professor at Charles Drew University, specifically the Mervyn M. Dimley School of Nursing. And also, I am a PhD student at UCLA School of Nursing. So, I got a lot going on, but I think I'm well informed to have this conversation because my current focus for my dissertation is discussing sexual health communication experiences with older African American women and their providers. So, trying to get an understanding of our experiences discussing sexual health with our provider and what areas are there that need improvement, what are some of our strengths, and really just getting a lot more insight so that we can better inform the community as well as healthcare providers.
Awesome.
So when we talk about older adults and sexual health, there is this stereotype or misconception that older adults are not sexually active. And it's an ageist stereotype, but it's just not true. Sexual activity occurs throughout the entire lifespan. So it's not just after you hit menopause, you're not sexually active. That's not the case. And a lot of older women are engaging in sex. So it's important that they're aware of their sexual health and they're presenting that transparently to their providers. And really a lot of what occurs is a lack of communication. And there are a number of reasons why that happens, but we'll discuss further on. But I do want to make the point that it's not true that older adults are not sexually active, and definitely not older women.
All right.
And
And
again,
even if you're not sexually active, there are things that occur that we still need to know about.
exactly. And that's exactly what I would get into. So let's take, for instance, you're not sexually active, but you may be having dysfunction such as vaginal dryness. And we know that occurs sometimes with menopause, it's very common. that could influence your mood, influence, how you are interacting with your loved ones and your peers. So it's more than just practice or the act of being having sex. It's like I said before, sexual health is very much all encompassing. It's your mental, your spiritual, your emotional well-being. And I do want to make the point that a population that we really need to focus on when we are discussing sexual health are cancer patients. So for a lot of cancer patients, there are side effects of the treatment that impact your sexual health. So we know that with surgery, such as mastectomies, it can change your body and change the way you view your body. And that could really impact the way that you're being sexually active or just how you feel about yourself, more importantly, right? We know chemo drugs can affect your mood, your energy level is depleted. Ooh. Exactly. I'm like, who can really do anything when their energy is low, let alone having sex, right?
So, one of the things that happened for me when I was taking chemotherapy, because I was only 40 when I was diagnosed. And so, I've always heard about PMS or whatever the case might be. But I experienced something that I thought was probably PMS in a great kind of way. And I knew it was related to the medication because it had never happened before and it didn't happen again.
Interesting.
But I was so much on my own nerves that I had to ask everybody around me to leave. Because I was just on my nerves. Things were changing as an effect of the medication that I was taking.
Exactly. And these medications, I don't think people really realize they're kind of toxic to the body because they're doing a lot of things. They're trying to fight off these cancerous cells. So like you mentioned, everyone has different side effects, but they definitely can affect your sexual health or just the way you feel about yourself, energy, mood, like you're mentioning your mood. So those are things that we need to be aware of when we're thinking about our cancer patients and how we can better address them when we're providing care, especially the healthcare profession. So getting into a little bit deeper with the sexual health, I do want to identify that older women are experiencing increased rates of STIs and STDs for a number of reasons, right? But it's important that we acknowledge that because we need to be transparent so that we can have these honest conversations with our providers. So specifically, gonorrhea, syphilis, and chlamydia have seen increased rates of incidents since 2014 and since 2014. So I want to just be clear with people. Sexual health, yes, it's all encompassing, but we also have to think about the infections that older adults are experiencing because they are sexually active. Although society will tell us, it's not happening, it is happening, right? And we know that for the most part, with any health issue, African Americans are disproportionately affected. We see this with COVID. We've seen it play out in HIV/AIDS, and therefore we are a vulnerable population. And so it's important that we're aware also of our HIV/AIDS incidence and specifically mortality. And for older African American women, this is important because if we're not having conversations with our providers about our sexual health, even our practices, as uncomfortable as that may be, or providers aren't talking to us, there's a missed opportunity for screening and diagnosis. And what I've seen when researching and speaking to a lot of older African American women who were diagnosed after the age of 50, they never discussed sexual health. They were never offered HIV tests by their providers. And by the time they're diagnosed, they're already at the level of AIDS. So they already have a diagnosis of AIDS. And we know with AIDS, there are a number of comorbidities that can influence your survival rate with AIDS. And it's just much harder to manage your condition once you're already at that point. But again, missed opportunities to really screen and have these candid conversations, especially.
That's really interesting because I don't think a doctor has ever asked me for an AIDS test, HIV screening. never in my whole life. I mean, I'm grateful that they think it would not be me, but at
Mm-hmm.
the same time, if this is prevalent within our community, I mean, I just no, it's like that's amazing. I never even thought about it.
Exactly. And so, and it may be the case that they're just doing it and not letting you know, although that's not something that should be happening. But definitely, as women or even just men are getting older, they don't bring up even the conversation about AIDS, how you can protect yourself or from HIV, STDs, STIs, let alone screen. So it's a huge detriment specifically to our community because we're disproportionately impacted by the epidemic.
Mm.
So something to think about also. Okay. Um, so along with that, I want to bring up the point of cervical cancer. So African American women, although we don't have the highest incidence of cervical cancer, we do have the greater mortality.
Mm.
Meaning, when we're diagnosed, our survival rates are much lower than any other racial or ethnic counterpart. And we know that for the majority of cervical cancer diagnoses, it is caused by HPV. That's a human papilloma virus, which is a sexually transmitted infection. And so we're facing this burden greater than any other racial or ethnic group. But it's important to have conversations with our providers, especially for older adults, about our sexual health practices or even just symptoms we may be having. A lot of women, after they hit menopause, they may be experiencing spotting or discharge, and they contribute it to menopause, which it can be something more underlying, like cervical cancer. And if the doctors aren't asking and you don't feel comfortable presenting that, then it's, again, missed screening and a misdiagnosis.
But
And
I think we also need to make a list of things that are occurring because by the
exactly.
time you get to the doctor in your 15-minute session,
Mhm.
you know, the doctor said,
That's
"Do you have any questions?" No. It's like, no, I want to pull out my phone and ask all the questions
exactly.
that have been happening since I was with the doctor the last time. And, you know, as soon as you walk out the door, you're like, "Oh man, I forgot." Oh, well, it's probably not important.
Exactly. And so I think for our community specifically, we need to feel empowered to do that. Sometimes we go into our appointments and, doctors are kind of rushing. And so we already have kind of a complicated relationship with the medical industry in general because of past history of trauma, thinking about Tuskegee experiment. But it's important that we feel empowered enough to ask these questions. And so, like you're saying, starting a practice of writing things down, keeping a journal, right? Because a lot of times people just pass things up as, I'm just getting older, or this is just part of menopause, but it can be something much more underlying and fatal. So I think that's a really good tip, keeping journals.
And another thing, at least for me, I can email my doctor, so I don't have to wait till my next appointment. I can, whether they answer it now or whether they keep all my questions together until I come in. And I was like, can you just look at the email? Because I put all my questions in there.
Exactly. And I think through this COVID pandemic, we're seeing a lot more incorporation of technology, right? And the use of informatics to reach patients. So that idea of being able to access your provider via email. And that might be actually a benefit to discussing issues like sexual health, things that may be a little bit more awkward to initiate or talk about in person. You can write that email and feel confident and not feel embarrassed to, discuss these things.
Yeah.
And yeah, so that's a really great tip. And I would encourage others to do that. Back to cervical cancer, though, I do want to mention that current cervical cancer screening recommendations, they don't include older cohorts of women. So after the age of 65, it's not recommended to get a cervical or a pap smear, which can help to identify cervical cancer, right? And that's not to say that people over the age of 65 don't get diagnosed with cervical cancer. So going back to reporting symptoms you have either via email or when you're talking to your provider, it's important, especially if you're over the age of 65, because you're not getting the screening on a regular basis. The recommendations don't require your provider to offer that to you anymore.
So what do you do? Because I still got life going on.
Exactly. And I think that's what I really want to get across to our community is advocate for yourself. Tell your provider, this is what's going on with me. I understand what the recommendations are. Is there any way that we can get, I can get a pap smear, right? A cervical cancer screening, a pap smear. And I think just being confident and knowing your rights as a patient. That's what all of this comes back to. Knowing your rights as a patient. You have the right to a second opinion, and you have the right to bring up whatever concerns you have to your provider. And I think what helps to foster this confidence and empowerment in discussing whether it be sexual health, your any other issues that you may be facing is a very trusting relationship with your healthcare provider. And a lot of times that's not the case. You may be seeing your provider only when things are occurring, you have a symptom, and so you haven't built that relationship. And I want to make sure to make the point that I'm not putting it on the patient, because there are also things that your doctors need to do, or your nurse practitioners, or your PAs, whoever you're seeing. But if we can find ways to foster that relationship, I think the trust would be improved and people would feel more confident and empowered to discuss these sensitive issues like sexual health or anything else that's happening. Yeah. So something for people.
What do I do? Because the other thing is when you talk about, the age barrier, the other one is where they don't want to do it except for every 3 to 5 years.
Yes. So
well, if I have a history of cancer, if I have, one time my doctor did have to tell me, Rhonda, everything is not cancer, so go see your regular doctor. I would go to the oncologist because I was going to the oncologist so often in that year and a half that I really began to see her as my primary doctor. Because I'd asked her everything while I was in there, so, and then she would direct or refer me as necessary. But when I went for a PAP and they were like, oh, well, you had one 2 years ago. Yeah, but I'm a cancer survivor. I know it, I don't need to have it every year, but how far can we push to get screenings, short of creating a symptom?
Exactly. I mean, I don't want to say that, but sometimes you have to finagle the system. But yes, you're right. It is every 3 years. And again, if you feel like you're having a symptom or you just want clarification on, what may be happening with your body, that's something you can ask of your provider. Now, I do know there's issues with insurance and making sure that things will get covered because it has to be based on recommendations, but it doesn't hurt to ask, right? And really just feel confident in explaining why you're having this request, right? Either you have a symptom or, like you're saying, you have a history of cancer, right? And therefore you want to have more information. But they do recommend every 3 years.
Okay. So at least we know that's normal.
Exactly. That's normal. Yes. And then also over the age of 65, if you've ever had an abnormal pap smear, they will still continue to do the pap smears. It won't be as often as every 3 years, but they just won't stop recommending it to you or offering it to you.
So abnormal equals cancer?
Not necessarily, but it can be precancerous, which is why we want to do screening early, because precancerous cells are identified and those are easy to treat, right? They're treatable, as opposed to waiting until the cells are already malignant. And usually symptoms don't occur until the cancer has progressed and it's actually moved to surrounding tissues. So abnormal doesn't necessarily always mean cancerous. It can mean precancerous or just something that your histology, the makeup of your cells is a little different, and it's something that triggers them to look a little deeper. Yes.
Awesome.
So don't always be alarmed by abnormal. But yes, so it's important that we have these conversations with our providers, because again, our community, our population, African American women, are facing the brunt of not only HIV and AIDS, but cervical cancer. We have, again, the highest rates of mortality among all ethnic groups. And as I mentioned before, it's preventable if you've had, your HPV vaccines, and if you haven't, it's definitely treatable, specifically in the early stages of the cancer. And so what happens, why we continue to have higher rates of mortality, is because it's not caught early on for our community. And that can be due to a number of factors. Again, providers not screening, women maybe not having access to healthcare. That's another thing. We're talking about people talking to their providers, but a lot of women don't have regular access to a healthcare provider or medical insurance in that case. But once it is diagnosed at a more aggressive stage, your options for treatment are limited. So we really want to make sure that women are being screened, and cervical cancer is identified early on, so that we have the best outcomes for survival. Yeah. And all of this comes back to, in my opinion, communicating with your provider, right? Communicating, trying to build a trusting relationship where you feel comfortable discussing symptoms, whether it's discharge or spotting, because again, those could be indicative of underlying issues. And through my research and what I've seen in the literature, there are so many reasons just why we're not having conversations about sexual health. And a number of them are provider reasons, and then others are patient reasons.
So can you help us out with some of those patient reasons?
Exactly. So there is discomfort or embarrassment bringing up your symptoms, right? Especially if you're an older woman and maybe your provider is a younger male. You don't want to tell them, I'm having a little discharge, some vaginal dryness. People may perceive that as being embarrassing or discomforting. Also in the literature, it's been stated that a lot of women, we expect our provider, or just patients in general, we expect our providers to initiate these conversations. So if they're not bringing up the conversation, maybe there's nothing wrong, right? Maybe there's nothing I need to worry about. So there seems to be some confusion about who needs to bring up the conversation or initiate it. In my opinion.
Sometimes, depending on the age of the person, depending on their household background,
Exactly.
depend on cultural background. We've been taught, don't say anything, don't talk about it.
Private, that's not fit in the house. Exactly. So,
but we're in a day and age where it's important that we fight for our rights. And, the whole theme of Celebrate Life today is ultimately choose life. And so if we are choosing life, then we have to choose to do things a little different than the way perhaps we were raised. A lot of the ways that we were raised, there's absolutely nothing wrong with them, except they might be dated and they could use a little upgrade. But it was good back then for a healthy individual. It can still be good now with a little tweak. So we just really want to encourage you to choose life. When you choose life, there are some habits and there are some situations and some things that you just won't do because it's not leading to a longer, healthier life.
It's not conducive to your health. Exactly. And you bring up so many great points. Thinking about culture, how we are taught growing up, this is private. We don't share private information outside of the household, or even sometimes you don't even share it among your family, right? Something you keep to yourself. So all of that does affect how, or if older adult or any person is going to talk about these sensitive issues or private issues with their provider. And I think, like you mentioned, we kind of have to shift our mindset on when we're talking about health. We can't keep it private, right? Because how would anybody know? How would our providers know if we're experiencing something or a symptom that needs to be addressed. So
Another thing you mentioned, maybe that doctor is a young male and you're an older woman. It does not take anything away from his value or his professionalism if you're not comfortable talking to him. Now, if it is which seems like a one and done kind of conversation, then okay. But if it's you constantly uncomfortable talking about some things, please know that you can change your doctor.
yes,
You might
please.
even want to tell the doctor, if that's the scenario, I really have a lot of respect for your professional expertise, but I'm not comfortable sharing these kinds of things with a young man. Can you refer me to a female doctor or a older doctor, so that one, I'm respecting his opinion, and his expertise. But then I need to be in an environment where it's comfortable for me to have these conversations.
Exactly. And what we always say in nursing and just healthcare in general is that we want to be patient centered. So if the patient doesn't feel comfortable, how can we truly meet their needs and provide, adequate and effective care? So that is always an option, asking for a different provider, and it won't take it, personal. It's their job to make sure that you're getting the best outcome as it relates to your health. Um, Research has also shown that sometimes we feel more comfortable with providers who look like us. So we know that I know for at least for myself, when I went to the doctor, maybe less than 6 months ago, I had to have a pap smear, and I felt so much more comfortable. It was a black nurse practitioner. We understood each other, we could relate. It just eased, some of my anxiety about having pap smears. And I still feel a little uncomfortable despite being a nurse. But I know I got to do it. So again, it's fine to ask your provider for a change, right? And maybe not necessarily it'll be a change that maintains throughout your entire medical treatment, but at least just for things like that. Maybe I just want to talk to a Black female physicians about some of the symptoms I'm having.
Because when you feel like the doctor can relate to what you're going through, one, you don't have to explain so much either.
Exactly.
Right.
Exactly. It's like
And
they already know,
and they
or
know
they know the
what
questions to
questions to
ask.
ask. There we go.
Exactly. They know the questions to ask. They know the questions to ask. So I agree. And I want people to feel empowered in doing that. I don't think enough people know that they have rights as patients, whether you're in the hospital setting or inpatient, admitted to a hospital, or outpatient, just going to a clinic. And if something doesn't feel right, or you're not getting an outcome that is desirable to you in terms of your care, sometimes you got to go up the chain of command. But it's not improper to ask for a different provider if that's what's going to make you feel comfortable and really allow you to be transparent about what's happening with your health. So I do encourage that.
And another thing, I'm just going to toss in a little plug right here to encourage African Americans and minorities to become nurses and doctors.
Yes.
Because there are people like us who are looking for you, for that relationship, that communication, looking for you to have that expertise. So if you're sitting on the fence about being a nurse or being a doctor, know that today is the day that you should do just this.
And do it. Get off the fence and just do it. And for me, that was truly a motivator for me to continue and get my nursing degree and license. Knowing that I could have an impact on my community just by being present, just by them knowing that it was an option, that there are Black nurses, there are Black physicians, especially Black women physicians, Black women female nurses. And so, again, we want to encourage people to go and pursue these medical professions. And I'll give a plug out to Charles R. Drew University, my employer, because we do have a school of medicine, or a college of medicine, as well as a school of nursing. So that'll be my plug.
Right.
But yes, and literature has shown that there's this concept called racial coordinates, and providers or patients seem to have better health outcomes when their provider is of their race or ethnicity. They're more adherent to their treatments. Providers can really speak in terms that they relate with. So, kind of just getting off of sexual health for a minute, but if you're diagnosed with diabetes, a provider will tell you a number of things that you cannot eat, right? So maybe it's bread, maybe it's pasta, etc. Those might not be things that are even reflective of your culture, right? And so a provider from your culture would know, okay, well, let me specifically tell them what foods that I know they eat that they should not, whether it's rice, whether, let's say, if you're from an African descent, Nigerian or Ghanaian, fufu, because it's high, it's a yam, right? So it's high in carbs and it can influence your diabetes. So even just those little things as patient education, all of that is greatly impacted by having providers, physicians, nurse practitioners of various racial and ethnic backgrounds who can really speak to the diversity of the patient population, because we're getting more and more diverse, and we can't keep having just one group of people providing care to us. Yeah. So thank you for mentioning that. But again, if anything, like Pastor Rhonda is saying, this is really an opportunity to choose life and choose empowerment, choose confidence, right? Especially with speaking to your providers, or even bringing up things or asking them, have you taken an HIV test for me? Have I ever been screened? Sometimes people don't even know what they've been tested for, and that's a problem in itself, right? So feeling confident, asking those questions is something I want to get through to people, whether it's about sexual health, about symptoms, about anything. You have a right, and if the provider doesn't seem to be accepting of that, there's other things that you can do. Get a second opinion always.
And if you go to Dr. Google and ask Dr. Google a question, please ask your doctor, the real doctor, the same question. Because if you were curious enough to look it up on Google, even if you get an answer that you agree with, consider still asking your doctor, because while that might be right information, most of the time, not all the time, but most of the time, it might not be right for you based on the kind of care and the treatment that you are experiencing. Because even like cancer survivors, we all know that everyone's story is different. Even if we're all receiving adriamycin or Taxol or Taxotere, if we were all lined up, there were 8 of us lined up getting the same thing. The dosage is different. There might be an extra medication added in mind that you can't see, or whatever the case might be. There's so many differences that occur, that when you're reading something from Dr. Google, or even from, the medical backgrounds, take that information back to your doctor and say, this is something that I read. How does it apply to me? Or is this in line with the care that I'm receiving from you? Because it's just so many different things that can make a world of difference. One little thing can make a difference, and you just want to make sure that you're in line. Because if you're going to decide to take the chemotherapy treatment or take the medical care that your doctor is recommending for you, then they're making that decision based upon everything they know about you. We don't realize
trying to
that.
figure out the story, and you got to give them the details. You got to tell them what happened from beginning to end. We're putting together. I remember when I used to work in the hospital, it's like I just have to get it out of people. So, what brought you here? When did it start? What were your symptoms? So, and like Pastor Rhonda is saying, if you go to them with something you found on the internet and you're just wanting to confirm or just get further understanding, no one's going to be upset by that. It's not like you're coming in and telling them, well, this is what, I researched and this, I have to have, eczema because this is what I saw. No, you're coming in informed and you're asking for clarification. And sometimes they may not know, but they'll refer you to a specialist. But they will appreciate as a patient that you've taken that extra time because it's going to help them figure out the story, the picture, so that they can best provide care to you. So everything you said is right on. Right on point. So, but again, thinking about choosing life, it's about choosing yourself and realizing that whether it's sexual health or diabetes, cancer, cardiovascular, it's important to have these conversations with our provider and being transparent. And specifically not feeling worried or uncomfortable about offending people. I know sometimes I feel like as a community, we're a little meek when it comes to our healthcare. And we don't want to offend people. We don't want to step on toes because we see providers in this authoritative figure. And they are to some extent, but they're there for you. And so I want people to feel confident to discuss whatever is going on with them or whatever questions they may have.
Earlier in the conversation, you mentioned HIV.
Yes.
But I believe you called it, and did you say an infection, but not versus a disease? Can you tell me a little bit more about that?
So HIV, technically, it's a sexually transmitted infection. So it's a virus. So people tend to separate them, but HIV falls under the line as a sexually transmitted infection. And so I think what you're mentioning or what you're referring to is the difference maybe between HIV and AIDS. And it's all about viral loads. And what I was seeing with a lot of participants that I spent time with is that by the time they're diagnosed with HIV, it's also considered AIDS. So they have a diagnosis of HIV, but their viral counts are so low that it's considered, sorry, not their viral lows, their CD4 levels are so low, it's considered AIDS. And so AIDS is much more fatal. I don't want to say fatal, but it's much more harder to manage and to survive because essentially your immune system is weakened. And we've seen people live with HIV for a number of years, thanks to medical advancements. But to be diagnosed with AIDS, as soon as you identify yourself as having HIV, it comes with a lot of challenges in trying to figure out how you're going to manage your diagnosis. If you have other comorbidities, it can continue to complicate how you manage and survive the disease or the infection, I should say.
Okay. Awesome. Wow. And
that's why
another thing that we tend to do, as we talk about finding, doing our self-care, our self-help, following Dr. Google, if we get a, say we find that we have a infection or a discharge and we believe it's this, or we believe it's that. And, I have some leftover antibiotic, or I have some leftover this, or I have some leftover that. One, why is it leftover?
Let's finish that. Yeah.
The other is I learned that if you had an antibiotic for the upper part of your body, it's not as effective for the lower part of your body. And that was something that I didn't even know was a thing. I thought antibiotics were antibiotics.
Mm-hmm. And I think you're touching on a point that is really reflective of like patient education as well as health literacy, what we know about health and how that is influenced by our conversations with our doctors. Because you definitely should not take a leftover antibiotic for any symptom, whether it's a discharge, a cough, runny nose. That's just not how it works. They're prescribed based off of your diagnosis. And again, one antibiotic is not going to necessarily be effective for a different infection or bacteria. So that's important to realize. Do not take, and don't share medications. Don't share medications. Grandma got some leftover penicillin. No. Just let's go to the doctor and let's get, our own prescription. I think that's just, our culture. We want to help, and sometimes the helping is not helping. In a better sense of words. But yes, that's
So
important.
can you think of some challenges that African American women have that you see often that maybe we could help somebody with today?
Challenges, health challenges, correct?
Like the discharge or
Oh, yes. Let me think. Well, definitely cervical cancer, right? We have increased rates of mortality of cervical cancer. And so specifically for African American women, I would say it's important that you're aware of when you had your last pap smear. Staying up to date on your screenings is very important. And so that means maybe downloading your app onto your phone so that you are engaged in your medical care, in your medical record. A lot of times we let those updates or those recommendations kind of just pass by, but it is important that we continue to look at those things and be aware of when we need to get the next screening and when we need to get a pap smear so we can identify if there are precancerous cells that may indicate cervical cancer. I would also say, I don't necessarily know if it's more prevalent among African American women, but yeast infections, right? Yeast infections are just something that unfortunately as women we deal with. But there are a number of things that we can do to kind of limit that risk. So making sure you're wearing breathable underwear, so cotton underwear. I know we all love our little cute Victoria's Secret silk panties, but really making sure that we wear underwear that are not going to promote the yeast infection. So cotton and breathable underwear is very important and something that you can make sure you incorporate into your daily lifestyle.
So what are some other things that we could do? Like I heard, what did I hear? Something about not wearing underwear to bed or wearing it to bed or something, or, you hear all kinds of stuff, some of it's old wives' tales.
And so from my education, I don't think it will matter if you do or don't wear underwear to bed. I think it's personal preference. I think it's more so the type of underwear that you're wearing, because certain underwear, like I mentioned, are not breathable. They attract moisture, which is going to allow yeast to continue to produce, thus create a yeast infection. So I think those might be a little bit more of the old wives' tales that our granny may have told us, but it's comfortable to not sleep with underwear on. So I can see why you would do it, but I don't think it's necessarily going to contribute to decreasing yeast infections. Right?
Okay.
And then I always am just as an advocate of healthy eating and nutrition. I feel like food always influences or is an influencer of our health. So eating healthy, making sure you're getting your protein, making sure you're getting your daily recommended amount of vegetables and fruits. As we get older, women, we need more vitamin D3. So that's also something that we need to take, specifically like for osteoporosis and prevention. And there's a big kick now on collagen. I don't know if you all have heard about collagen, but a lot of women are taking collagen powder, and I'm one of those women because it's been noted to help with like just your skin, your hair, your nails, as well as joints. So collagen helps with your joint mobility and keeping those joints very limber and lubricant. So a lot of women are taking collagen, and you'll probably see after we leave here, if you Google it, there's so many different brands of collagen, and what I do daily is I just put a scoop in my coffee. It has no flavor, and hopefully I'm adding to my joints a little bit more, giving myself a couple more years, limber joints. So that's another thing that I'm seeing.
Okay. Wow, this has been a great conversation. I'm trying to think if there's anything else. I know there's a couple of people who are watching. If you have a question, please feel free to type the question in the chat box, and so that we can address it. Um, but what we really want to do today is encourage African American women to talk to their doctor about their sexual health.
Yes.
And I just want to just like let that silence sit there for a moment. Talk to your doctor. And there's one thing that I know a lot of people say, well, I don't have enough time. Um, I don't have enough time to with the doctor. Well, there's a one little secret. At when you make your order, and what your order, when you make your appointment,
Like the order,
ask
right?
for a double appointment because you have a lot of questions. You know, you can't do that all the time, but every now and then you should ask for a second. So you have two appointments together, so that 15 minutes just turned into 30. But even when you do that, you want to make sure you go in prepared with a list of questions, a list of symptoms that you've been having, and stop diagnosing ourselves. When you go in and talk to your doctor, whether it's about the topic of today, which is African American women's sexual health, or any other concern or issue, do not go in and tell the doctor what you believe is wrong with you. You want to go in and lay out your symptoms. You know, I feel this and I do, you know, and then, you know, only at night I have this, first thing in the morning I have this, or whatever the case might be. Or, you know, my headaches, they last 30 minutes or they last an hour or they last all day and it's just gnawing, whatever it is. We want to keep, you know, giving them the symptoms on what is going on with us. Because if I understand correctly, now I'm not the nurse, I'm just an advocate. But whatever, once you start telling them, there are a number of different things that have those kind of symptoms, but as you tell them all of them, there'll be one. I was watching The Good Doctor, and they found one little thing and it flipped the whole diagnosis around, and they were able to save that person's life. So you want to talk about those symptoms. Don't just walk in and say, I have a cold and I need this for my, because one, if the doctor's really, really busy, they might just give you what you asked for.
Mm-hmm.
But you don't want that. You want
Exactly.
them to treat you for what you're going through today and right now.
Exactly. I would just echo that. Come in, I would say, prepared, right? With all of the details. You know, like when you tell a friend a story and, you know, you get into all the details about what happened, what this person did, what that person did, the same thing. When the cough started, how it felt. Was there any sputum or or actual phlegm coming up? What the color looked like, right? What helped it? What relieved the cough? All of those details are important so that the doctor can make an informed decision or at least order the right tests to further up on what may be going on.
Exactly. All right. Well, is there anything else, Attallah, that you would like to share with us today?
I would like to, I can't, so I'm in my PhD program and I'm getting ready to hopefully start recruiting participants for my study, but I can't recruit now, but I do want to just provide my information. If people are interested, I will be doing a study in the future about sexual health communication experiences among older African American women with their providers. So what have been your experiences discussing sexual health with your provider, specifically for women over the age of 50, because that is my area of focus. So I will provide my information. Maybe I can do it in the chat.
You want to tell me and I could put it there too?
Yes. It's
What is it?
A as an apple, PT, D as in dog, ILLARD at ucla.edu.
All right. There we go. So they can just send you an email indicating that they are interested in the focus group or project that you have coming up. And that project has to do with what?
It has to do with sexual health communication with providers and African American women, specifically women over the age of 50. So technically, I'm not recruiting right now, but if you're interested in my topic, just feel free to email me and I can provide you with more information, and especially when I get closer to doing the focus groups. So please feel free to contact me, even if you'd like to learn more about sexual health or even ways that you can initiate a conversation. Because I think sometimes having strategies is best for people when they're going into situations that they may not be familiar with. So I'm open to you all, and hopefully my research will change some things for our community as it relates to sexual health.
So we have a question. How often should women over 65 get a pap smear? And what are there any age differences?
So typically it's not recommended after the age of, there is not a screening recommendation for women after the age of 65. So after 65, they won't necessarily recommend a pap smear, but if you feel like you need one or you are having symptoms, then you can always request that, from my understanding of how, but things are always changing with the recommendations. But I can definitely send you all information from the CDC to clarify that for you.
Okay, great.
And then what was the other part of I know there was another part of the
question. Are there any age differences, I guess, for pap smears?
Well, of course, after 65 or before 65, it's recommended that women get a pap smear every 2 to 3 years, specifically starting at 30. So if you're 30 years old, then they are going to recommend you get screened every 2 to 3 years. Women over 30, it's usually every 3. And then 65 to 70, if you haven't had a abnormal pap smear in the past, you can kind of go, it's not necessarily recommended. So you can kind of stop getting the pap smears. But again, you got to listen to your body, even if you feel you have a symptom or you just want clarification for yourself. You can always ask that of your provider. But at about 65, 70, they are not going to be recommending pap smears every 3 years.
But you know, you just brought up a big one. So many of us don't want to touch ourselves. You know, whether you're doing a self breast exam or, you know, you need to know what you look like. You need to know how you feel, and not be reliant upon someone else to tell you that something is different.
Exactly.
I would just encourage you all to know your body, know what's normal. You know, this is not our topic of today, but when you finish using the restroom, look, take a look at what you deposited, because there could be something very obvious, and some of us don't even want to do that. So it's important that we know what's normal for us. You know, it was amazing. I had a good friend of mine. There was a season where I was drinking a lot of beet juice. I just was in love with beets and carrots together. Oh my goodness. And so she came over and I shared my beet juice with her. And then she had a doctor's appointment and she went to the doctor. And then at the end of her appointment, she said, "And doctor, my urine is red." And she said, "Oh my goodness." She said, "Have you had any beets yet lately?" And she said, "That Rhonda." But she was nervous about that until she went to the doctor, right?
Yes.
But when you begin to do different things and you know what's normal for your body, if she had not looked, she would not have known.
Exactly.
You know, so look,
Exactly. Look at the tissue, especially a lot of us, we wear panty liners. Look at the end of the day, especially if you're still at an age of where you're having menstruation. You want to know the changes in your discharge. You want to know how your flow is every month, right? Because abrupt changes may indicate something. Know your breasts, right? Know if you have, a lump somewhere that's, has already been identified as not being a tumor or malignant, but you got to touch yourself, and you have to be aware of your body. So you should know your body like the back of your hand. So
Okay.
I would encourage that as well.
Well, this has been a great conversation. I want to thank you, Professor Attallah Dillard. Thank you for taking your time to be with us and to share this important information. Um, as the host of Celebrate Life Today, this is a new station that is running on the Hope Broadcasting Network. We invite you all to join us each Wednesday at 1 o'clock. As we will bring a different topic each week. And our topics will have to do with health and wellness. There'll be nutrition. There might even be an exercise class one day. Who knows? But I want to bring on our professionals, our nurses, our doctors, our community advocates who are very aware of the challenges of our community so that we can bring education to you. And even for Celebrate Life Cancer Ministry, the services that we provide include home and hospital visitation. We are treatment buddies, telephone buddies, hospice support. We host monthly support group meetings on the first Saturday of each month, which are held on Zoom. And all of this information can be found on our website at celebratelife.cm.org, or you can give us a call at let's see, the phone number for this one. Well, one number is 424 424 258 5433, or you can reach us at Celebrate Life Today 2021 at gmail.com. And this is our television show is an extension of our regular ministry programming. So we are here to provide services to those with cancer, those who love them and go through the journey with them. We appreciate all that you all are doing by joining us here today, and we look forward to seeing you soon. So until next time, choose life. Thank you again, Attallah.
Thank you so much, Pastor Rhonda.
Let's see if I can make this.